Hello, my name is Carolyn George, and the genetic disorder that I chose to do my research project on is called Duchenne muscular dystrophy, which is commonly referred to as DMD. Description of disorder. Duchenne muscular dystrophy is a genetic disorder that affects the muscles by causing them to break down and then to become weak. It is one of 9 different forms of muscular dystrophy, and it is fatal. This form of muscular dystrophy is more prevalent with boys than with girls and affects approximately 1 in every 5,000 boys each year. This disorder is caused by a lack of the protein called dystrophin, which is pictured on the bottom right portion of the screen. Dystrophin is the protein that supports muscle growth and maintenance and helps to keep the cells of a muscle together. When absent, harmful effects begin to set in, muscles begin to break down, and weakness occurs. This protein is what transfers energy to cause the muscles to contract. Due to fibrous tissue formation in the muscles, inflammation begins to set in. Inheritance. Duchenne muscular dystrophy is typically a family inherited disorder. It is recessive and it is linked to the X chromosome. There have been cases, though, where DMD occurs because of a new mutation inside of the mother's egg. The trait is expressed in homozygous recessive males, and they inherit it from the mother. Females have a 50% chance of passing the disorder on to their sons and can be carriers without ever knowing it. This trait affects mostly men because the XY chromosomes are what makes males males. The X chromosome is where the dystrophin protein is produced, so the disorder is inherited from the mother. Inheritance continued. While DMD is very rare in females, it can still occur. The XX chromosomes are what makes females females. If they inherit an X chromosome that carries the trait, they still have a normal X chromosome that produces enough dystrophin-producing protein. The trait is expressed as manifesting heterozygotes, and females who inherit a faulty X chromosome will still have some degree of muscle weakness. Affected gene. The X chromosome is where the DMD gene is located. The dystrophin protein works to keep the muscles in the heart and skeletal regions in order to help keep them strong. Additionally, the protein works to protect these muscles against damage. There can be more than 200 different mutations of the gene. Most involve the dystrophin protein being deleted. When mutated, muscles begin to break down and damage occurs. Symptoms. Symptoms usually begin between ages of 1 and 6. Symptoms include many falls, struggling to get up from sitting and lying down. The hips, the pelvis, and the shoulders are first affected. The trunk and the arms are affected second. Calves are larger, difficulty running and jumping, tippy-toe walking, and rigid joints, which can result in pain. Toddlers may have enlarged calves, which is called pseudohypertrophy. That means false enlargement. This occurs because scar tissue can form because of the abnormality in the muscle tissues. Preschool-age children tend to be clumsy and because of that fall more easily. Children at the preschool age have difficulty with running, going up and down stairs, and getting up from a variety of positions. Symptoms continued. Additional symptoms that occur include walking that resembles waddling, curvature of the spine, which is known as scoliosis, difficulty breathing due to diaphragm involvement, and cardiomyopathy, which is heart enlargement. Also, some patients have learning disabilities as well as difficulties with communication and social interactions. School-age children begin walking on their tippy toes and or balls of their feet. In order to stay balanced, children may pull their shoulders back and push their bellies out. Between the ages of 7 and 12, children may start to gradually transition to using a wheelchair. At first, the wheelchair might be used to help preserve energy when going long distances, and then once the transition is fully made, the wheelchair allows the individual to become more independent. Diagnosis. CK level testing, which is also known as enzyme tests, look for high levels of creatine kinase. It is a blood test and looks for muscle disease. Electromyography is a test that checks a muscle's electrical activity. Genetic testing checks DNA cells to see if there is a mutation in the gene and where exactly it is. Muscle biopsies are used to differentiate between DMD and other muscular disorders. Heart and lung monitoring tests check for heart and lung functions. Treatments for DMD. Currently, there is no cure, and treatment is for symptoms only. Treatments include steroids, which help to slow the loss of muscle strength, albuterol, which helps to improve breathing, assisted ventilation, which aids in breathing, and eteplirsen, which helps to increase muscle strength. Additional treatments include spine surgery, which is used to help treat scoliosis, orthopedic options, such as wheelchairs and braces, to help improve mobility and independence, beta blockers, angiotensin, and diuretics all improve heart functions. Physical therapy to help improve muscle strength, flexibility, and mobility. Cost of treatments. Each year, it is estimated that treatment costs $52,952. Broken down, medical costs are $22,533. Non-medical costs are $12,939, and loss of income is $15,481. Equipment needed includes wheelchair, standing frame, mechanical lift, braces, shower chair, an electrical bed, and a wheelchair accessible van. These costs are all approximate generalizations of costs. It depends on a person's insurance, the individual's severity of the disorder, and where they are living. Cost of equipment. Equipment can be purchased or rented. A power wheelchair on average is $12,000. Standing wheelchairs are between $18,000 and $55,000. Leg braces are $393.74 per year, which is a total of $787.48 for both. An electric bed, which is $895, a patient lift, which is $312, and a wheelchair accessible van, which is $40,000 to $60,000. Again, cost of equipment ranges based on an individual's insurance, the severity of the disorder, and the location of where the individual lives. Home modifications. Widening doorways. With a widened doorway or doorways, it allows for an individual with DMD to move through the house with greater ease. Using lever-style door handles, using half-height box spring or no box spring to help lower the bed. Lowering the bed allows the patient to move from the wheelchair to the bed and the bed to the wheelchair or the standing position with greater ease. Using home controls that are smart. For example, voice-controlled smart home controls. The voice controls allow for the individual to use their voices and to be more independent within their houses, using grab bars in the shower, raising or lowering the toilet seats, and installing a wheelchair ramp. Patient support. We all know that having a disease is a struggle. The patient support websites on this slide allow for support for individuals who have Duchenne muscular dystrophy. As you can see, the first two groups are in Ohio. Image sources for my presentation between slides 1 and 7 are here. Image sources from slides 9 to 13 are here. And this is my works cited page.